Good afternoon, and thanks for joining us for today's Healthline. I'm Courtney Butts, and today we're talking about leveraging technology in orthopedics with Dr. Chatrath, who's an orthopedic surgeon and director of joint replacement surgery with Willis-Knighton Bossier Orthopedics. Good afternoon, and thanks for joining us.
Thank you for having me, Courtney. I really enjoy being here and talking to you guys about this, so thank you for the opportunity.
Yes, absolutely. And you are the expert in orthopedics, if you will, and you're also the director of joint replacement, which is huge. So tell me a little bit about why you decided to, go into this specialty.
So, orthopedic surgery, we usually have a definite goal in mind. So it's instant gratification for me too. For example, before I came here, I did my morning clinic. I saw patients who I have operated upon, and they come to clinic, and you can see how it's made a difference to their lifestyle. They can do things which they were not able to earlier. They're able to, play with their grandkids. They're able to go out for a walk, even simple everyday tasks.
Yeah.
I saw an individual this morning who is going to have a shoulder replacement with me, and she said, I'm having trouble combing my hair and dressing myself. Now, imagine yourself in those shoes,
right.
How hard it is for a female that, well, I can't even put my clothes on properly. So, and then when you see them, they're able to do it after we've completed the surgery, the recovery process. It's like the old saying, there are certain things MasterCard cannot buy, right?
Right. That's so true. So
yes.
the gratification, it's such a rewarding, I'm sure, line of work.
Absolutely, absolutely. I feel blessed and honored to do that.
I love that. Cool. And something that you've also done with in partnership with Willis-Knighton is bringing lots of new technology and robotics and things to your patients, and I'm sure that improves their outcomes as well.
Yeah, Willis-Knighton has been an excellent partner in my journey. Here I've been able to bring robotics. Apart from that, we've brought other technologies as well, which we've tried and showed. You've actually tried it, the Hip Insight technology, which is called augmented reality. Apart from that, we have introduced something called cementless implants. So previously, we used to use a lot of bone cement. Now with the cementless implants, the benefit is it helps us to preserve the bone stock, makes the surgery a lot faster, lot cleaner for the patients. So wherever possible, we try to use cementless implants as well.
Okay.
And then I am a big believer in minimally invasive surgery. Surgery itself, is an attack on your body. If I can minimize it and help you recover faster, I always try for that.
Yeah, that's so true, and it helps their outcomes and maybe their recovery. Maybe shorter recovery time as well. So what types of surgeries, you kind of specialize in joint replacement, but kind of go through what your clinic and what you specifically perform as well.
So I do hip replacements, shoulder replacements, and knee replacements. That's the majority of my work. For each surgery, I try to bring something unique to my patients. So let's talk about hip replacement surgery. Hip replacements were done by the old traditional approach, where we would make a cut on the side of their hip. We would cut through the hip muscle. So basically, if this is the muscle, we would cut across it, okay, and then perform the surgery. Patients would take a while to recover. Because you cut the muscle, there would be scarring as well. So we do something called the anterior approach, in which we don't cut the muscle, we go split the muscle, and we go between the muscle. And you get a tiny scar in the front of the hip rather than the old large scar which people would get. That basically shortens the recovery time in half. So wherever possible, we try to do what we call the direct anterior approach and the minimally invasive approach. Now, I'm competitive by nature, so I was just not satisfied by becoming an expert on the direct anterior approach. I wanted to take it to the next step.
Okay.
So that's where I went and looked at this technology called Hip Insight. Basically, during surgery, I'm wearing a helmet. Think of it like Iron Man. The visor in front of me, or front of my eyes, will show me the exact position of the patient's skeleton. So it's like having 3D vision.
Right.
I can see where I have to put the components in and basically match the target to the actual thing. So it shows me a bullseye I actually have to match the target to the bullseye, or
Okay.
the actual implant to the bullseye. So that eliminates errors. So that's where Hip Insight has been extremely useful for bringing the next step in hip replacement surgery.
Yeah, pretty cool.
Yeah.
So it's kind of like from the movie Iron Man, you have Jarvis,
Yes,
right?
yes.
Okay.
Except my Jarvis is a live person
Right.
who's doing it on the computer. So hopefully someday it'll. I love the guy, but hopefully
Maybe you could have an actual Jarvis. Right?
correct,
Cool.
exactly.
Yeah, technology is so cool. So Hip Insight, as the name implies, it's mostly you just use it for hip replacement.
Correct.
Yeah.
So, and then when it comes to knee replacement surgery, again, the traditional approach was to make a cut in the front of the knee and then cut the muscle, which we call the quadriceps muscle. Okay. So, how do we improve on that? So, we still make the skin cut, but then instead of cutting the quadriceps, we take the quadriceps to a side, which is called the subvastus approach. What this does is, I have not made a cut in the muscle itself, and by doing the surgery, I just have to flip the muscle back, and again, helps in recovery, less scar tissue, better mobility.
Gotcha.
Now, like I said, what was the next step?
Right.
So now that we've done hundreds of these, move on to making something better, even better. So we added robotics to it. And we do the surgery using robotics, and it takes the human error away. Right away, I get real-time feedback. So usually with the knee replacement, you do the knee replacement, you see the patient later in clinic. Well, but now the deed is done. You can't change it. When you're using robotics, you get live feedback at the same time. So if I see, I don't agree with this, I can make a change there and then and get a good outcome for my patient.
Yeah. Okay.
One realistic problem which used to be with knee replacements was the use of a tourniquet. A tourniquet is like a blood pressure device which we use on the thigh to control bleeding. But people used to get extensive pain from tourniquets. So as a student or when I was a young trainee, I would see that. So last probably 7 years, I've gone away from using a tourniquet. So we do a bloodless surgery. We get some special equipment to dry up the bleeding as we go along.
Wow.
And by eliminating the tourniquet, we've taken that pain away.
Interesting.
Yeah, so we try to leverage technology in every little piece we can.
Yes, and always improving too. So with these advancements and maybe like the anterior approach or the the approach to where you're not cutting the muscle, do you have to have some kind of specific training for that, or is that something that tell me a little bit about that?
Oh yeah, absolutely. So a lot of specific training for both. I was fortunate enough that I trained with some of the guys who were pioneers in this. So back in 2010, there were very, very few people who were doing this. And I was lucky enough to train with one of the individuals who taught me how to do the direct anterior, how to do the muscle sparing approach in knee replacements as well. So I was just combination of maybe luck and a foresight that I was able to work with the best mentors and learn those things.
Very cool.
So I spent actually a couple of years extra being a trainee, whereas I could have gone into the workforce earlier. So I said, no, I'm going to spend 2 more years and learn these things more.
Yeah. Okay. And as you can imagine, you're muscle sparing, so it's a quicker recovery, right? So, in any case, would there be a situation with a patient where you would have to cut the muscle?
Yes, like yesterday I had to.
Okay.
This individual I did surgery on, they had a rash where I would have placed my incision. So there was no technical way to do it because it would create a chance of infection.
Right.
So I had to go to a traditional approach. That's rare, but we're always ready for these things, which is important because you don't want to be one size fits all. You have to be careful, you have to pick to make sure your patient gets the best outcome.
For sure, yeah. Like you said, individualized approach.
Yes,
you speak with the
absolutely.
patient beforehand. So yeah, talk about how you run your clinic. It's not like you just call up your office and say, I want to schedule surgery, and you do it the next day. You definitely meet with them and talk about their options.
Yeah, so we have a really, really good system in place. Most of these patients who come and see us have tried other options. with their family physicians. They've tried injections, physical therapy, some medication. When they meet me, we talk about their options one more time. We talk about surgical options, and if we decide mutually, it's always a mutual decision that we're going to go ahead and do the surgery. Then we give them a booklet of which, honestly, I've written everything myself, every single word, and those booklets are separate for hip, knee, and shoulder replacements.
Okay.
We give them the booklets. We invite them to something called a joint camp. A joint camp means every second Thursday, we run a 2-hour camp, and patients who are not even having surgery, if they are interested, they're welcome to contact us and we'll accommodate them. They talk with our physician assistant. They talk with pharmacy, anesthesia, physical therapy, and a social worker. So when they talk to all these individuals, they give the whole plan of how the surgery is going to proceed, how your recovery process is, and physical therapy, so that they have the complete spectrum already available to them.
Cool.
Because it's a big decision. A lot of these folks sometimes have family members who are living in other states. They have to coordinate a visit. Then if somebody is living alone and they can't go home right after surgery, we have to arrange a rehab for them. So we have a comprehensive program for this. Then they get lab work done to make sure that they're ready for surgery, they're optimized for surgery. We involve the anesthesia team, the cardiology team, and a lot of blood work is done to make sure that even simple things are not missed before the operation.
Right.
So it's a very comprehensive approach of how we do this.
Very cool. I didn't know about this joint camp that you do. So you do that every other Thursday.
Correct.
Okay, and how do patients sign up for something like that?
So usually these are people I've seen in clinic and who have signed up for joint replacements either with me or my partners. And they go, sometimes I've had patients come and see me and say, we're not ready for joint replacement, but we want to know about it.
Oh, okay.
And they've also come and attended joint camp, and the usual feedback that we've got is, I love it.
Yeah.
I love the joint camp. That's the usual feedback.
Yeah, and anytime you're going to schedule a surgery or undergo the knife, it's a scary. Sometimes it's a scary decision to make. So that can put a lot of people at ease, I'm sure.
Yes. I've always followed a simple philosophy. Anytime I see a patient in front of me, I just think, what would I do if it was mom or dad or a family member? It makes the life very easy and simple for me.
Yeah.
Like I'm talking to a family member, if I would offer the same thing to my sister, well, I will offer the same thing to this individual. The decision making is not hard then.
Right. Yes. Well, if you're just joining us and you maybe have a question for Dr. Chatrath, we're talking about joint replacement surgery, and we're talking about advancements in this realm of medicine. You can give us a call at 318-219-4569. That number is right there on your screen, and we'll be happy to take your questions or comments and direct them to Dr. Chatrath to answer them. That number is right there on your screen. So we have talked about, robotics, but we've talked a little bit about augmented reality and, artificial intelligence. What other ways are you using artificial intelligence in your practice?
So what we do is we use them specifically to leverage in shoulder replacements, partial knee replacements as well. And in fact, even in the hip insight, there is a bit of artificial intelligence built in. What we do is, let's just say somebody has a need for a shoulder replacement, and I'll get a CT scan or an MRI. That information is sent over to Montreal. And in Montreal, the bioengineers will basically use the AI model and build me the equipment to use during the surgery.
Wow.
So they 3D print it. The 3D printing equipment is so accurate that the one meant for your left shoulder will not fit your right shoulder.
Cool.
So it is very individualized and specific. So they use a combination of AI, 3D printing, and generate these models, which are then shipped to me to be used during the surgery.
Cool.
And when I do the surgery, I will go back and forth looking at the actual patient's anatomy and the model, and I'll use that equipment to place it so that whatever implants I'm putting in the patient, my accuracy is excellent, I hope.
Yeah. Okay. And better outcomes again. You
Absolutely.
know, always great for the patient as well. So we talked a little bit about the cementless technology that
Correct.
you're using. So when I hear like cement, tell me a little bit. It's not
Sure.
really cement, but it's it has maybe similar. Tell me a little bit about it.
Sure, absolutely. Yeah. So this is something called, which is in common parlance, we call it bone cement. So think of it basically like a grout.
Okay.
Okay. As we grow older, especially women after menopause, their bones are weaker. So we had to use implants, and the gaps in the bone, we had to fill that up using bone cement. Okay. Now, as we started developing more implants with cementless technology, these implants have a special coating on top of them. This coating is very porous, so bone can actually grow and interlock
Cool.
into it. So basically the implant becomes a part of the bone itself. So one of the implant devices that I use, they came out with this technology to use it more in knee replacement surgery. And I think it was last August or September, I had finished over 100 surgeries of those. So they
Yeah.
actually sent me a congratulatory letter about it.
Very cool.
They're one of the few surgeons who had done hundreds of those with this particular technology. And the benefit is, we want the implant to grow into your bone.
Okay.
So your bone latches on into it. So the chances of this thing coming loose go down.
Okay, right, and less chance for you to have to do like a revision surgery and that
Correct.
kind of thing. Okay.
And because the cement interdigitates into the bone, it also helps us, if we someday have to redo the surgery, it preserves the amount of bone on it.
Okay, very interesting. Okay,
Yes.
well, we do have our first caller. Kelly, thanks for joining us. And what is your question for Dr. Chatrath?
My question is I've been listening to the talk about knee and hip replacements and that type of thing. I've got a wrist injury, and is there any type of replacement surgery or anything for a wrist? Only thing I'm being told is that all they can do is fuse it together.
So, Mr. Kelly, thank you for calling. And yes, there are options for wrist replacement as well. I don't perform them. I have an excellent partner, Dr. Diego Miranda, and he does a great job with wrist replacements. Obviously, you have to be the right candidate. The wrist being very small in size does not have so many options. If I put it in simple words, there's not a lot of real estate there to work with. So not every person is a candidate for a wrist replacement, but you are certainly welcome to make an appointment with our office. Our phone number is 318-212-7841, and talk to Dr. Miranda, and he's the expert on wrist replacements.
Okay, thank you.
Absolutely. Hope you have a good day.
Yeah, thanks, Kelly, for joining us. And if you have a question and you're just tuning in, you can give us a call at 318-219-4569 to talk directly with Dr. Chatrath. So we were just talking about cement versus cementless
Yes.
technology. So tell me how it's what the outcomes are if you use one or the other.
Absolutely.
That makes sense.
So the other benefit with cementless technology is it's very quick. Okay. So the surgery becomes shorter. Anytime I can reduce the duration of surgery, reduce the duration of anesthesia, reduce the amount of bleeding during surgery, all these things will translate into faster recovery, less scar tissue, better range of motion. Okay. So like we had spoken earlier about the use of a tourniquet. When I do a cementless joint replacement, there is zero need for a tourniquet at all. We actually want some of the blood to contact the implant, and that will help in the whole process of interdigitation, which I was describing like this.
Okay.
Yeah.
Okay.
So ultimately, what it does is it helps the patient recover a lot faster. Plus, there's an indirect benefit to it. You can only do cementless surgery if your technique is precise.
Okay.
If you are off by even a couple of degrees, cementless is not going to work out. So I have to be really good to do the surgery with precision, so I can place cementless implants on it.
Gotcha.
I don't have cement as a backup. So in a different way, you can argue it the other way, that it makes the surgeon a better surgeon too.
Okay. Yeah, because it's like the accountability there,
Correct,
right?
exactly.
Interesting. Okay, so we have our second caller, Melissa. Thanks for joining us. And what's your question for Dr. Chatrath? Oh, well, maybe call us again if you get a second, Melissa. If you're just joining us, give us a call, 318-219-4569. So yeah, back to the cementless. That makes sense, because the cement is kind of, like you said, maybe backup. Right?
It's like, if you've ever done a little bit of flooring at home, you mess it up a little bit, you can put grout in there.
Right.
Right? You can add a little grout. Here, there's no option of grout.
Okay.
So there is no messing up here.
Absolutely, but and there are better outcomes usually
Yes.
with the cementless technology.
Correct,
Cool.
absolutely. Plus, some of these patients who are a little younger, let's just say 25 years down the road, they end up for a revision surgery. They need a redo surgery. Then the amount of bone that comes out is a lot less when we redo the surgery as compared to with a cemented implant. Because when you have to dig out the cement, we have to take out a lot of bone along with it.
Gotcha.
So we're also thinking ahead that, okay, 25 years from now, let's just say the next generation of surgeons comes along and they do revise this, then it helps them.
Makes sense. So it really is, you're paying it forward.
Yes,
so
absolutely.
that you're preserving their bone.
So bone preservation is important.
Okay, very interesting. Okay, and then let's say that someone maybe is, you mentioned that there's a lot of steps that people take before they have that conversation with you about joint replacement. Do you provide those injections maybe to help preserve the joint in your clinic as well?
Yes, so a lot of times, because patients can come and see me directly or through their family doctor, they don't need a referral.
Okay.
So they come through both pathways, directly or through the family doctor. And if they come directly and they've not tried other options, so many times we'll take care of physical therapy, doing injections, doing medications with them. Even the injections are various kinds. Like one of the injections is a simple steroid injection. Then the other one is something which people call it differently as gel injection, chicken coom injections, things like those.
Gotcha. Well, Mary is on the line. Thanks, Mary, for joining us. And what's your question?
Yes, I've been told that once you have hip replacement, that if you fall again, it's very easy to break it. Is that true?
Hello, Mary. Thank you for calling. So if you've had a hip replacement and you fall, usually nothing's going to happen to the metal itself. The metal is pretty strong, but the bone around your hip can shatter. And sometimes that can make the hip replacement implant unstable. And then we may have to do things to change that. But typically, nothing's going to happen to the metal. It's very strong. It's the bone around the metal that's going to break.
What are they, bone? Are they metal or plastic?
They're a combination of metal and plastic.
Apart. Oh, okay. So it's still safe. Even if you carefully fall, you're not apt to break it again.
Yes, but I would highly recommend not falling. So if you're having balance issues, talk to your regular doctor.
That's what I needed to know.
Yeah.
Okay, thank you and have a good day.
You too, ma'am.
Right, yeah, so...
the first goal is don't fall.
Well, and you said if you're having balance issues or issues with your gait, what do you suggest?
So we do get a lot of patients because since I do hip replacement surgery or hip surgery, patients have back problems. So it's confusing to the patient, is it my back or is it my hip? And when the back gets affected, there is a condition called spinal stenosis, in which basically the spinal cord gets crushed inside your bone. One of the most common symptoms you see is patients losing balance. And some of these individuals, a common sign is at the grocery store, you'll see them stooped over a grocery cart actually to get their balance going. And that's usually because of spinal stenosis. So we help them figure out whether it's the back or it's the hip. Physical therapy plays a big part in it. A lot of times your middle ear controls your balance. So if you're having ear problems, that can affect your balance. And we'll identify that, send them to their primary doctor. If an ENT doctor is needed, or a back specialist is needed. So we try to help out with those things.
Gotcha. Yeah. And so maybe let's say someone is having, hip arthritis or even arthritis in their knee. What are some practical tips and tricks, advice that you would give them to maybe prolong or preserve their bones before surgery?
Absolutely. So depends on the stage of the arthritis, but some simple things that you can do is make sure you're getting some weight-bearing activity. Even a small walk, a 20-minute walk every day is excellent. It will keep your joints strong. Then keeping the weight under control. Okay, we all don't have to be Brad Pitt, but in a certain amount of weight, that weight control is extremely important for joint health.
Okay.
Now, certain supplements, which again, this is my disclaimer that we're not very sure whether these work or not, but they've shown some promising results is fish oil, glucosamine, and chondroitin. These are simple things which you can buy at Sam's Club, and they've shown benefit with joint health as well.
Okay, very interesting.
Yes.
Okay, and so let's say we have a couple minutes left. Let's say someone maybe is having issues with, their knee, shoulder, or hip, those things that you specialize in. Do they need a referral from their doctor to see you?
No, they do not.
Okay.
They can directly come and see me.
Okay.
They do not need a referral through their physician.
Okay, and they can maybe attend joint camp if they see that surgery's in their future, even if they're not going to be scheduling.
100%, yeah. We always want people to make an encouraged decision. Having a joint replacement surgery is a pretty big deal. Okay, so I want to make sure that the patient is not only physically ready, they're mentally ready as well, because that will influence the outcome.
Okay.
There is a lot of it's teamwork.
Yeah.
It's me and you working together, right? I can do the surgery, but I can't do the physical therapy for you.
Right. Yeah.
So that's where the patient has to put the effort in, so that team effort helps both of us come out as winners.
Yeah, and let's say someone is scheduled for surgery, are they required to do joint camp before, or is it kind of just an extra little something that they do?
So that has been a point of debate, because we do get patients who come and see us. We've had patients come from 3 hours away.
Oh, right, yeah.
So it's very hard for them to come for multiple appointments. We were actually thinking of setting up a virtual joint camp, where they can log into Willis Knighton and they can look at joint camp and attend that.
Yeah, that would be cool. So,
absolutely.
Okay, and so if someone is interested and they want to talk about the next steps, or maybe they just want to establish care with you, where are you located and what's a good phone number?
So we're at Willis Knighton Orthopedics Bossier campus, and my name is Dr. Vik Chatrath. Our phone number is 318-212-7841.
Great, and that's as easy as it gets. You just give them, they would call you or your office and get set up with an appointment.
Absolutely, they would call our office, and we have an excellent front desk staff. They'll help find an appropriate time, and they'll get you in a timely fashion.
Okay, so we've learned a lot about technology and orthopedics, and I know that you said you're competitive. I'm sure a little perfectionist as well. And,
yes.
You definitely always, rolling out some new technology and new and improved things for your clinic.
Absolutely. I mean, we strive ourselves. Not only me, my partners as well. We're always trying to get something new, a little extra, and make sure whatever latest and greatest is out there. This weekend, my partner is going to the Louisiana Orthopedic Association. We're always trying to learn new things and see if we can bring that to our patients.
Absolutely. Well, best of luck to you. And in your 2025, hopefully you'll have more things to add to your clinic as well.
Thank you very much. I appreciate you so much. And I always enjoy talking to you.
All right. Thanks, Dr. Chatrath. Thanks for joining us. This will be on ktbs.com/podcast.